Hello everyone, welcome back to my channel, The Theoretical Doctor Audio Blogs. In this video, I will be talking about the different types of pediatric wards. Us, as house officers, had to rotate in during my third posting in Sarawak General Hospital. The link to the article of this audio blog is available in the description below if you would prefer to read on it instead. I encountered my first stays in the various types of wards in the pediatric posting. Coming from the orthopedic posting, there were limited number of wards, albeit having multiple subspecialties. However, they were all located in the same ward. In the obstetrics and gynecology posting, the wards were limited as well, but there weren't such things as subspecialties. In the pediatric posting, the wards that most of us had to rotate in are General Pediatric Ward 2B, Pediatric 4A, Pediatric Isolation Ward 3A, and Nursery Ward. The first one, General Pediatric Ward 2B. The General Pediatric Ward 2B, otherwise known as PEDS 2B, is located at the side building at level 2. The age of patients here ranges from as young as neonates to up till 17 years old. The median age of patients here are from 1 year old to around 10 years old. This ward was my assigned ward upon entering this posting, and most of the cases that were admitted here is respiratory illnesses such as acute bronchiolitis, acute exacerbation of asthma, viral pneumonia requiring oxygen support from as low as nasal prong up till CPAP or BiPAP. Occasionally, some patients with febrile seizure are admitted for monitoring. There are instances when some patients would be electively admitted for IVIG, sleep study, or certain procedures. The morning shift is from 7 a.m. till 6 p.m., while the night shift is from 6 p.m. till 10 a.m. The second one, Pediatric 4A, for neonatal jaundice, NNJ. If you are in PEDS 2B, you are required to take care of PEDS 4A as peri. The patients located here are usually babies referred from Klinik Kesihatan for neonatal jaundice requiring single phototherapy or intensive phototherapy. PEDS 4A is actually the pediatric surgical ward. However, some patients are under follow-up by the medical team as well. Working the day shift in PEDS 2B, if one is allocated as the peri house officer, we are required to review the patients in PEDS 4A who are under PEDS medical follow-up as well as the neonatal NNJ babies. However, if one is working the night shift, they are required to take the coming morning bloods of the NNJ babies. The third one, Pediatric Isolation Ward 3A. The Pediatric Isolation Ward 3A or PEDS 3A is a general ward similar to PEDS 2B. However, patients who are tested positive for COVID-19 are quarantined here. The age of patients here ranges from as young as neonates to up till 17 years old, and the cases are similar to cases admitted in PEDS 2B. Working during the morning shift is from 7 a.m. till 6 p.m. and the night shift is from 6 p.m. till 10 a.m. The fourth one, Nursery Ward or NICU, which stands for Neonatal Intensive Care Unit. The babies ward. The Nursery Ward and NICU are located at the same place with the NICU located at the back of the nursery ward. The patients who are admitted into the nursery ward or the NICU are admitted right after birth. The babies admitted into NICU are usually those that require NIV support, to be intubated, or born extremely preterm. Babies who are admitted into the nursery ward are babies being stepped down from NICU support or babies who are admitted right after birth for observations such as presumed sepsis for respiratory distress, presumed sepsis for maternal chorioamnionitis, infant of mother with gestational diabetes mellitus, or post-vacuum assisted delivery. These are just to name a few of the cases. There are also patients who are transferred out from maternity ward and admitted for monitoring, such as presumed sepsis for vomiting and presumed sepsis for hypoglycemia, just to name a few. I will elaborate more on our duties as a house officer in the nursery ward or NICU in another part. Working the AM shift in this ward is from 7 a.m. to 7 p.m. and the PM shift is from 7 p.m. to 10 a.m. The fifth one, Nursery Level 1. Nursery Level 1 is an extension of the nursery ward. Albeit the name Level 1, it is actually located at Level 3 of the main building, opposite the Maternity 1 ward at the back of the vascular ward. Most of the babies admitted here are stable enough to be left to their own devices without extra monitoring from the medical doctors. Most of them are admitted for neonatal jaundice requiring phototherapy or have been admitted for many months and have been stepped down from NICU support to nursery monitored for sucking and feeding, gaining weight, and finally about to be discharged soon. Hence, being allocated here as the house officer, it is our duty to ensure that the planned discharges are complete, as this will hasten the discharging process the following morning. Some of the babies here are staying in their own cot, just like the main nursery ward, while some babies are rooming in with their mother. The sixth one, Pediatric 2A, the oncology ward. The Pediatric oncology ward is located beside Pediatrics 2B at the side building at level 2. As the name suggests, it is an oncology ward. However, I'm unable to elaborate on the tasks and job scope as I've yet to experience working in that ward. The last one, PICU, Pediatric Intensive Care Unit. The Pediatric Intensive Care Unit, otherwise also known as PICU, is located near the nursery level 1, which is at the main building, level 4, opposite the maternity 1 ward. Sadly, I am unable to elaborate on the job scope as well and cases seen, as I've never been allocated to this ward. These are the pediatric wards that us as house officers rotate in the Sarawak General Hospital. Each ward has its own challenges and interesting cases. If you're going through peds or about to go through, remember to enjoy the process and journey and to learn as much as you can. Thank you for listening to this audio blog. To stay tuned for more, which will be available every Wednesdays, Thursdays, and Fridays. Remember to click on the subscribe button as well as the bell button so you won't miss out on any upcoming audio blogs.